As Jeff said, I'm Shannon Stotenbur-Wing. I'm with the Michigan Public Health Institute, and I'm currently working with the state Medicaid IT office in the consumer engagement space, really thinking about how we operationalize everything that we've heard in the past couple days about consumer engagement, and currently working in the Department of Health and Human Services to help that messaging. One of the things that I wanted to just touch on briefly is I was getting ready this morning coming here, and I got an alert on my phone that my young son has a well child check tomorrow. It was just a reminder. So I told him, don't forget, you have your well child check tomorrow. And obviously he was not thrilled on that reminder, because well child check when you're a little boy usually means probably one shot or one kind of uncomfortable situation. And my older son looked at him and said, "Let me tell you a story." And I'll tell you, it really resonated with me because that's been the theme of the last couple days. Whether it's our technical colleagues that you just heard from Maine, and Aaron from NATE, we really think about telling stories. We all have stories to tell. Yesterday we heard from the folks from Susan G. Komen and from the Autism Alliance. We are in such a unique position to not only be decision makers, but we are also consumers of that decision. We are really thrilled to be able to have some national contacts today, some vendors that are really looking at this idea in the space of consumer engagement. And how do we not only be decision makers on the bigger, broader scheme in the technological scheme, but then how do we also level set with the consumers? Remember, Lieutenant Governor this morning says we want to meet people where they are. This is exactly what we need to do. We can stand up every piece of technology that we have, but it's only as good when the consumer is using it. We want to make sure that we're keeping all of that in mind. As Aaron said and as Nate said, we're going to show a video for you right now that is a collaboration of MiHIN and NATE, the National Association for Trusted Exchange, and it looks at how we educate patients and we educate that information to ensure that they know what is available to them. We can roll the video.
My dad had a heart attack last week when I was out of town. The doctors and nurses told him what to change so it wouldn't happen again, but he can't remember what they said. I wish someone could write it down so I know how to take care of him.
I've had a lot of doctors over the years. When I have to tell my medical history, I forget things. I can't give the right information. I wish I could just see all of my records in one place.
Accessing health information can be difficult, but it's your information. You have the right to use it to manage your health and your family's health. There are tools to help you get your health information to be sure it's accurate. Share it with your doctors or family and have it available whenever you need it. Today, your information is stored wherever you get treated. There are lots of smartphone apps and internet tools to help you track and share your information. But these tools aren't always connected, making it hard to find what you need. Using your smart device with any app, which includes Blue Button, gives you a secure way to receive and share your health records. This happens through a secure email address, called a direct address, like you see here. Here's how to obtain your information on a computer, tablet, or smartphone. At the doctor's office, a doctor or nurse simply enters your direct address into their computer system, and the record of your visit is sent to the app of your choice. It's that simple. Some doctors offer a different way to get your health record by downloading it from their patient portal. Now, your health information is where you want it, and you can do the same thing every time you see a doctor. These tools are available now, but some doctors may not know how to help you access and share your information yet. Ask your doctors today about getting your health information. If they need help, visit nate-trust.org/bluebutton for a letter you can give to your doctor to help them help you.
The doctor sent Dad's health records to an app on his iPad that lets me see all of his instructions, so now I know how to help Dad stay healthy.
I've downloaded my records and now I can track everything in my online personal health record. I can use my phone to see my information anytime I need it.
Your health information belongs to you. Work with your doctor to better manage your health and the health of your family. Your health is in your hands.
Thank you to Nate and MiHIN. It's a great opportunity to be able to push this information out. And I just remember hearing something from the last panel when the gentleman from Maine said, you know, what do people even think that we do? Having opportunities like this to talk about how we're doing the work and how it really resonates with ourselves too, that we can do this and we can say, I get to use that too. I have my own patient portal. I can show you what I do, and we can help as we care for our family members. I want to take a moment to introduce our panel. You can read their bios in your conference registration. They're going to come up and just give us some brief talking points on what they're doing in their marketplace and what they're doing in the consumer engagement space. Then we really want to take some time to hear from you and be able to ask them questions. We have some questions for them here as well, but if you please feel free to let us know if you have questions from the audience. So Christina Caraballo is a senior healthcare strategist from Get Real. We have Shub Debgupta, who is the founder and CEO of Wiser Together. And we have Shameet Luhar, who is the co-founder and chief executive officer of Vita Health. So if you'll join me in welcoming Christina first.
Thanks, Shannon. Hello, everyone. I'm Christina. I'm a senior healthcare strategist at Get Real Health. I work for a vendor, but I'm more excited about health IT than probably anyone in my office. They make fun of me because when I hear the word blue button or interoperability or data, I get really excited. So I want to just start off by saying thank you for the opportunity to be here in Washington. You know, we sit and look at everything that we think looks great, but to actually be in an environment where we can hear conversations and hear what's really happening is really exciting. I was really excited about listening to the Michigan Health IT Commission. Some of the things I heard, like the buzzwords that really just show how ahead you guys are things like, collaboration, engaging the consumer, looking at how we can partner, looking across the care spectrum and continuum, and using the patient. So before I start, I just want to take a moment and see who has a patient portal. And when I say that, I don't mean who's offering a patient portal to their consumers. I mean who in this audience actually has a patient portal. About half of you. So who actually goes in and uses it? Great, we're getting somewhere. About 2 years ago, I asked the same question to a group of people, and I just got blank stares. So this is exciting. So I'm going to give you a little bit of an overview of Get Real Health. Sorry for the marketing stuff. I know from after I give you the overview so you understand who we are, we're going to really talk about what we're really trying to do collectively. So who we are. We are a patient portal, but to us, it's not just a patient portal. Patient portal doesn't mean patient engagement. Patient engagement, I think, has become this really open-ended question about or concept, and it means so many different things to so many different people. If you're talking to a physician, it might be about looking at data for a patient in the clinical setting. If you're talking to a consumer advocate, it's about getting data to the consumer so that they can make changes in their health behavior and start taking control of their own health record and collaborating with their care team. So a little bit about us. We were recently named #1 patient portal on the market by Chilmark Research. We are more than just showing your data to the patient. We're offering data visualization tools to our patients through lots of widgets that kind of are building blocks that we can easily configure throughout our site and make to meet an organization's unique needs. To us, patient engagement is more than just VDT. It's more about looking at how we can increase patient satisfaction, improve the healthcare delivery system, align not only with today's needs, but tomorrow's needs, and improve clinical outcomes. So our value proposition is to really take collaborative care using the patient and the family care team, as well as the provider, and improve outcomes, reduce costs, improve care transitions and care coordination, all while filling the requirements of meaningful use. So here in the US, we kind of, champagne bottles burst in our office when we saw that patient engagement was actually becoming a reality in this country. Get Real Health started in 2001. We started as a professional services shop, and then we moved into, in 2007, we launched with Microsoft Health Vault. We are the largest Health Vault developer in the world, but have moved past just using Health Vault as our data source. But at that point, we really realized that there was a need in the market for consumer-friendly tools, and there really weren't any. So at that stage, we've spent 100% of our energy focusing on patient engagement tools. Here in the US, we didn't have much of a market, so we went international. We went anywhere we could to find providers who really saw the value in patient engagement. So we are a white-labeled solution, so we are everywhere, you just don't see us. We're in Canada as the largest, with TELUS Health, which is the largest telecommunications company in Canada. We are in the province of Alberta with over 3.5 million users on our portal. We are in Australia with Telstra Health, which is their telecommunications. We are in the United Kingdom with 3 of the national trusts, including South London and Maudsley, which is mental health, University of Southampton, which focuses on irritable bowel syndrome, and we are just won the orthopedic national trust over there. So you can see we can take our portal and make it really flexible or meet different needs using that same, those same widgets, same platform. So what makes us unique? Oh, well, I guess I'll back up. So now that we see meaningful use, we've seen a real need here in the US for patient engagement solutions. Everybody's scurrying to check their MU box. I will say I think our biggest competition is the tethered EHR portals because they're easy. Providers can just turn them on and get them out to their patient, but they're not all really providing value. So our clients really get the long-term goal, like the value of patient engagement. They see how these tools can change health behavior, can improve care, can reduce costs in our healthcare delivery system. So some of our clients here in the US include Catholic Health Initiatives, New York Presbyterian, New York Health and Hospital Corporation, KeyHigh, which is Pennsylvania's Health Information Exchange, St. Luke's up in Boston, and Stewart Health, which is an ACO. And they're kind of using our portal a little differently. They're focusing on employee wellness to see how the portal works to begin to engage patients. We also have the Immune Deficiency Foundation is another one of our clients using our portal to try to get clinical research, and they are actually a PCORI grant recipient, which is the Patient-Centered Outcome Research Initiative. So let's see, some of our value proposition or key to success is that we're completely flexible. Our deployment time can be weeks instead of months. We're able to rapidly respond to organizations' needs. We have the ability to skin and brand portals to match your unique look and feel. At the HIE, we can sit up here as at the mother level and have kind of child portals that are skin and brand to match each of your organizations with their logo and everything, but everything's flowing from that same data source. So if a patient were to log into their portal, no matter which hospital or provider they went to under that umbrella, all that data would flow into one place. And with the view, download, transmit requirements of meaningful use, as long as any of those patients were seen under that umbrella of care, whatever that ecosystem that has been created, they will all get their little check for that patient logging in to view their health record. So I think with that, I will pass it along.
Thank you, Christina. Now we're going to hear from Shub, who's going to talk about Wiser Together.
Thanks, Shannon. Thank you, Christina. And thank you all for having us. What I just realized is all three of us are from the DC, Baltimore area, so thank you for organizing great weather for us. So this is really spectacular. I'm really excited to be here. I'm Shub. I'm the founder and CEO of Wiser Together, a very unique and a very different in kind solution, but it's really solving a real problem. Being a consumer in healthcare is really hard, and that's a challenge. So when we talk about consumer engagement, you really need to understand how do you solve that problem. What Wiser Together does, and I've got a few slides to kind of walk you through it, but really trying to explain how we're all consumers after all of healthcare, how we make decisions. And understanding that really, really drives any success or any achievement that you can have in patient engagement, consumer engagement, and solving the last mile. How do you get in front of the consumer? We are a personalized treatment and shared decision solution. We help consumers be consumers. That is, find, compare, understand their treatments, and engage with the next step, with their providers, with their services, with the vendors that you offer and make available to them. And by doing so, driven by the patient, you achieve better health outcomes, you reduce costs, and you make patients happier regardless of outcome. It really is the case. Where we fit in is we're solving a problem that is in the care continuum today. There's a gap in the care continuum in how patients make decisions. And when you solve that problem, the science behind doing so is there is no doubt about it. There is studies in JAMA and Health Affairs, New England Journal of Medicine, all about it. If you help the consumer, we all know this, we've all seen the same studies, you help cut costs, but more importantly as well, it is strategically important right now as we're moving to a more patient-centric world. So this is the challenge that you all face, that we face as consumers and as service providers and thinkers in the space. There is a gap, a pretty costly gap in the care continuum today. There's a gap where wellness ends, so being healthy, all the wearables, all staying fit, where wellness ends, and before care management, provider support, or any medical services support kicks in. There's a gap that is growing because of the cost, risk, and cost share that you've been pushing onto the patients. Patients increasingly find themselves in this gap, and this is a gap when they have to make a decision when they have a health condition for the first time, when they get a test result back from their test, which gives them some result, a high-risk result. What do you do? That gap right now is underserved. People are falling through that gap, and they're going to Google and WebMD, common resources out there, friends and family. And those are terrible, terrible experiences because it's overwhelming. We've all been there. We're all going to die. It's a terrible, terrible experience. And it's scary and overwhelming for a patient who's looking to make a decision at that time. How do you sift through the information? Back pain, last week at 170 million hits. This week, 172 million hits on Google. 2 million hits in a week. That's amazing. And how are we going to make sense of that? And people are falling through that gap. They are navigating the system on their own, privately. And then they come back into the ecosystem with a scheduling service because their neighbor told them about this great orthopedic surgeon. And usually when you come back that late into the ecosystem, your cost is not compressible, your outcomes are not usually very changeable, and you've lost a huge opportunity in understanding where people are and guiding them in that gap. And in that gap, consumers are being patients. Patients are being consumers. They're asking similar questions that you would. What are my options? How do I understand what they are? What should I do? Give me some guidance around these options, and then where can I get it? And there are a number of solutions that are slowly being put together on how much will it cost. You have cost transparency and price transparency making an entrance. And this is just in the early stages. It's still a price list. How do you make that more actionable for an individual? How does it become a more shared collaboration and discussion with the provider and the provider system? Where should I go? There's a few private resources available through provider search and guidance and concierge services. But more importantly, All that happens after you decide, what should I do? And right now, that's a hole. That's a missing gap. If you can fill that gap, you'd be able to address a big challenge that consumers have. And if you don't, which is where we are today, there's more trial error in the system, there's treatment shopping that happens, drop-off, low adherence, patient satisfaction is poor, and plan loyalty, provider loyalty suffers. This is the kicker. When you think about a consumer being a patient being a consumer, or an individual making a health decision, this is really, really hard. The average person, and this is the behavioral science behind it, the average consumer would evaluate about 22 different options or factors before making a health decision. And they break down into 3 large buckets. So think back to when you were making a health decision. You want to understand whether it will work for you medically. There are essentially about 6 elements on that front. Well, is the treatment effective? What's the evidence behind it? What are the peer experiences? And so on and so forth. Will it work for you financially? Depending on your coverage, time off work, cost, out-of-pocket costs, your tax-deferred accounts, will that cover it? There are 5 elements on that front. And the third bucket is, will it work for you personally? We all have personal factors, criteria that matter. Criteria around invasiveness, difficulty of the treatment, pain, recovery speed. You are evaluating those factors, 11 of those front. And you and me would weight or rank order these different factors differently, depending on the condition. So how could you, as you're thinking of helping somebody make a decision and engage that patient, you want to be able to personalize it or help them with these criteria. It has to work clinically, it has to work financially, and work personally for them. That's when you are able to get a solution that'll work. That connected with a provider, a shared decision, not just a provider, it could be the nurse, could be any entry point. Where you talked about the different portals. There are a number of different entry points for people in healthcare. How do you help them at that entry point engage in a smart way? And this requires bringing together a number of different disparate resources. When you're talking about working clinically, the provider obviously weighs in. There's protocols, there's clinical evidence, there's provider search, there is evidence-based medicine out there. There are a number of different studies that are published. How do you put that all together in a way that's meaningful? On the left-hand side, whether it will work financially. There are a number of initiatives on front, but they need to be put together in context. Cost transparency, the cost itself, from whether it's covered or not. And the third is whether it will work for you personally. And this is missing. You want to be able to understand intent, preferences, understand that last mile, because that drives patient adherence, patient compliance with treatments, and the ultimate outcome. Putting it all together is really, really powerful. And doing that in a personalized way and recognizing and understanding the patient, and then tying it back to the record so that the next person who comes in, the next provider, the next expert who touches the patient will know that patient X has a cost, is concerned about costs, is worried about invasive care, and will be able to deliver a much more personalized experience at that interaction. That's the value. You get that right, we'll be able to solve patient engagement, consumer engagement, and help improve treatment outcomes and lower costs. Thank you very much.
Thank you so much, Shub. Now we'll hear from Shameet with Veda Health.
It's coming up. All right. Well, good afternoon, everyone. As Sharon mentioned, my name is Shameet Luhar. I'm the co-founder and CEO of Veda Health. And prior to starting this company, I spent 5 years at Anthem, where I was part of a data analytics startup where we built clinical compliance programs that touched Anthem's 33 million lives. Yet, if you take a look at the catalyst for starting our company, it's really what they're doing today, and a number of health insurers are continuing to do this today. Which is, if you want to solve that consumer engagement problem, you can't do it with paper messages that are going to the member's home. It's based off of data that's 30 days old, oftentimes more, and when you and I, as a health plan member, ultimately receive it, it's too late. Same thing goes with telephonic outreach. It's a very two-dimensional conversation, and in order to increase engagement, it's very important that you develop a personal connection with whomever you're speaking with, whether it's a health coach or whether it's your provider. And before we get into a little bit about what we do, what our big value proposition is, why our company exists, is that we work primarily with health insurance plans to help them lower the occurrence of acute events for very high-risk members with chronic conditions, and achieving that in two fundamental ways. First is this idea of human touch, where we provide access to a dedicated health coach that members meet with weekly over live video conference through our mobile app. And then we supplement that with digital tracking tools that automate data collection. And our system continually mines that information to identify opportunities to intervene before these members are on a path to being hospitalized. Now, the solution that you see up on the screen here, we broke it down into a 4-step process. But really, if you want to be able to have this solution be successful, we believe that there's 3 key things that you must be able to do. And the first thing is to create a support system. The members that we work with primarily come in 3 areas: Medicaid, Medicare Advantage, duals. This population is very transient. They're very difficult to get a hold of. Oftentimes, if they do have access to a mobile connection or a smartphone, they have limited minutes, and 40% of them you often can't reach. And so the way we solve that is through our mobile app. We preload it on a smartphone that every single member who goes through one of our interventions receives, and it has unlimited talk and text. So now that 40% of individuals that you can no longer reach, you have a dedicated phone number that you can reach them on. The second piece is building a relationship. A minute ago I talked about our older solutions, which were very two-dimensional based. What we do is we provide a third dimension, and that third dimension is through that live video conference interaction. Kind of very similar to the interaction that I'm having with you. It's face-to-face, it's live, and I can pick up on your various nonverbal communication. And if I'm a health coach and I'm talking to one of my members, those nonverbal cues are extremely important in helping me better understand the condition of my member and helping me understand better understand what the root cause of the condition that he or she is having, and may lead to further questions to help them better diagnose and better understand what they need to do next in order to prevent that hospitalization from occurring. The third piece is that it's not just important to collect data. Collecting data doesn't do any good. You have to make it actionable. And from a member's perspective, specifically the 3 categories of members that I talked about, that data has to be seamless and has to be easy to capture. What's the biggest barrier to patient compliance? It's the patient. And so what you need to be able to do is make it easy. So for example, we'll supply them with a care package if they have diabetes, for example. We'll send them a internet-enabled blood glucose meter, a cell-enabled weight scale, and even an activity tracker. They don't even have to connect it to their phones. It's already internet connected, communicates with the cellular network. They just check their blood sugar. It registers up in the cloud, and we pull it into our database, and our system's analyzing it to really understand the patient's state of health. And then we can provide at not only a health plan view, but also at an organizational or a provider view, what's happening with your membership. Who's compliant, who's non-compliant, who are the high opportunity members that you need to get in front of now to prevent that hospitalization and lower those costs. And so some of the outcomes that we've seen with this population, keep in mind the outcomes that you see here are with Medicaid populations that we're working with across the country. 21% A1C decrease, not typically something that you see with this population. Satisfaction rate, we were speaking with a health plan down in South Carolina, and the plan president put it best, where he's like, I love this double edge approach. where you hook them with the phone, and then you also provide a live interactive service to really engage these members. 95% of them are satisfied with it, which is pretty impressive to us. Care plan compliance, another big indicator of engagement, at 84%. So 84% of members in our interventions are meeting with their health coach on a weekly basis and also using digital tracking tools that we're providing them. And then, of course, finally, the engagement rate, right? So 87% engagement rate with a Medicaid population. You typically, as I mentioned, I came from WellPoint. Those numbers tend to hover around 10 to 20%. So this is pretty remarkable for us. Just one of our many success stories that we like to talk about is an individual who was going through our intervention, and we saw our system identified an escalating blood sugar over a 3-day period, and because of that, our system triggered them as a red flag on being on a path to hospitalization, and resulting in a triage event, or a triage event between us, the health plan, and the member, and the end result was that we were able to prevent that hospitalization from occurring. And it turns out the reason why the member's blood sugar was so high is because the label on their medications was scratched off, so they didn't know what dosage they should be taking. And so in short, as I mentioned, simplicity really drives everything that we do. And if you want to be able to increase engagement, compliance, in addition to satisfaction, while lowering your costs and hospitalization and ER expenses, it has to be simple for the health plan member or the patient. Otherwise, it's just not going to work. So with that, thank you so much, and look forward to hearing your questions.
Thank you so much. As you can see, we have a different perspective being able to speak with vendors that are out there and talking to other companies, other areas, and talking to the consumers. I have a couple questions ready for the panelists, but I'll take questions from the audience. I have somebody up front here that has a question.
Thanks. That was an incredible presentation. You guys are all superheroes as far as I'm concerned. Thank you for what you're doing. I could ask each one of them a question very briefly. When you ship the phone, does it come with the mobile license so that they have phone service? If they don't have phone service, are you shipping phones? Only 2/3 of the population have smartphones today. You ship the phone, and it includes the services that they would need for your product?
Absolutely right.
Yeah.
Yeah, that's absolutely right. The phone, in addition to those disease-specific biometric devices, gets shipped to the member in a care package. Specifically, to answer the question related to the phone, yes, it includes our mobile services preloaded with our mobile app, and then depending on the health plan that we work with, there's various other services that we link, such as Medicaid transportation line, 24/7 nurse line, the member's PCP, in addition to our mobile app. And then I mentioned during the presentation that the phone also includes unlimited talk and text.
Outstanding. Your product is really very, very engaging. I think it's important to show bringing in other sources of data and combining financial information about the consumer and so forth. How do you gather that data for a large population? If we wanted to do it in the state of Michigan, right, how would you find out who has HSAs and how much, what it pays out for, so on and so forth?
So we absolutely, what you state is absolutely critical, integrating the data from the number of different sources. So for example, cost transparency relationships. So we built up relationships with all these large providers of such data. So be it cost transparency, be it through the HSAs, we have partnerships with these organizations. So we'd be able to pull the information in. What's really critical is that, as we talked about in the 11th government talked about being where the patient is, the patient can now enter into healthcare, the entry point for healthcare is changing. So previously it used to be through the plan portal or the service provider. That no longer is the case. They can go to their wellness player, they can go to the HSA vendor, they can go to any different vendors. And there are multiple such platforms. We've talked about the portal as well. if we can sit on each of those and we have developed relationships in each of these ecosystems, you'd be able to, and we can recognize the patient, so there's an Uber patient. So no matter how they enter, their information transfers. So they would be able to see, for example, their plan coverage, the Medicaid population, what's covered, the networks that they're looking at, their service providers, additional services that are offered to them that are made specifically available to them, and with their cost localized to them. So it's a very powerful personalized experience and allows other folks to provide context-based information guidance to these individuals.
And Christina, you know, being a global company operating in, Australia is a great example of a single payer system. Do you see adoption and engagement easier in those countries than, say, the United States?
Yes and no. I think, you guys, it doesn't work for me. Yes, it's easier in the sense that if the government says this is what we're doing, then that's what happens. But I'm going to shift the question a little bit. I was recently in Germany at a conference called Medica, and it's a big health trade show. And I had the opportunity to meet with probably 8 to 10 different countries, and the conversation was really interesting because what I realized was that we're all having the same conversation when it comes to patient engagement. And everybody's looking at the US, and here we give ourselves a hard time, and we're like, why doesn't everything interoperate? Why can't I get my data from place A to place B? But the world's looking at us, and they're really impressed with how far we've come since 2011 when we decided, hey, let's get electronic health records across the whole country. So I think that we sometimes need to take a step back and realize all the progress we have made, and realize that we all see health IT as a tool, and we see that internationally, and we see it as a tool to reduce cost and improve care, and that's universal everywhere. The world is becoming flat when it comes to health IT, and everybody is starting to look at the consumer. Everybody sees the patient as a way to achieve these goals. So I think that it really is the same conversation no matter what your healthcare delivery system is.
Thank you for those questions. I think maybe you got the sheet of my questions that I had teed up. So one of the things that I just want to follow up with on that is I have spoken with Shub before about some of the work that they're doing in the consumer engagement space, and we know that based on the social determinants and the things that are going on in folks' lives, that is a bigger predictor of what they choose, how they choose to deal with their health issues. So a lot about what we're talking about is how do you partner with those non-traditional partners? So it's great to have our labs and our reminder appointments, but how about a safe place to walk? To utilize green space for exercise? How about things like just identifying other ways, transportation issues? The Lieutenant Governor talked a lot about that. Can any of you speak to those non-traditional partners and reaching out to them to kind of incorporate that into the bigger health IT space?
I can kick it off. This is really about understanding the consumer as a patient. This is understanding them as a whole person. There are a number of factors that influence them as a decision. So I founded the company based on a personal health experience my wife had when she was going through her first pregnancy, and we had to make a decision around once the test results started coming back of what to do and how do we proceed, and that was really hard. I have a PhD in economics and behavioral economics, and I struggled, as my wife does. She's a faculty in Georgetown, and we struggled with that decision. And it wasn't about the information that was provided to us. It was in the context of our situation. So given who we were, our access to medical professionals, what we were willing to do, the personal side of it was really important. And the question really was, how do you take that personalized need for information, context-based relevant information, and scale that across large populations? Because we cannot afford or even implement a one-on-one interaction in a much more scalable way. We can do it with some more tools, but cannot do it across populations. And that's what Wiser Together does. It captures that information once, early on, and then uses intelligence, predictive data technologies to kind of build that out into the ecosystem. So every subsequent interaction that you have, be it through a provider that's a specialist seeing them for the first time, or their therapist that they are assigned to, everybody gets the basic information about the patient and is able to build on it. So you're really building a knowledge base about the patient before claims really hits. So this is a new open space around a consumer or about a patient, and you're building that knowledge basis longitudinally, which is really important, and understanding the context of how the patient makes decisions, either privately or shared with their spouse or partner and their provider. That's very valuable information. If you just take a step back and think about Amazon and Target, for example, these large retailers have built this information for their consumer goods. They understand their consumers far, far better than despite the billions that we spend on healthcare, we know our consumers. And that's what we're trying to address.
Thank you. Shameet?
Specifically, when we work with our members, one of the first things that they do is they complete what we call an adaptive onboarding assessment. It helps us identify deficiencies in really two key areas. First is your traditional clinical areas, but then the second is your psychosocial, your socioeconomic. And so to your point, Shannon, about how does a member know of the best location to take a safe walk. We actually have a database that's built into our technology. So if me as a health coach, I'm speaking to you as a member, and one of your barrier areas is safety, we can log into our database will tell us, will provide a community of resources that are quote-unquote safe based off of what your needs are, depending on what you need at the time, whether it's food, whether it's shelter, whether it's a place to walk. So that's just an example.
Great, thank you. And really taking a step back, how are you then, you kind of alluded to it just now, talking about, how do we make contact with the consumer? How do we know when it's time to say, okay, here are the tools that we have for you? What are you guys doing in terms of resourcing providers and systems and other folks to help them articulate messages and help them show the consumer that this is something that we need for them to be that shared decision maker, that this is not just something else we want them to do, that we really do encourage them to share in that process, and that we understand that making these decisions in their health could impact their lives as a whole, whether it be time off of work or childcare or not being able to work themselves to provide for their family. How are you guys resourcing providers and systems in articulating that message to your consumers?
That's a great question. It's a great question. It comes down to the data, and we are able to show that when you have a patient that comes in already prioritized or thought through their options, treatment options, their compliance goes up with the treatment, they are that much more satisfied with the interaction, and the trial error of these treatments, the drop-off goes down. So that really appeals to providers who are either carrying risk, cost risk, or looking at the outcome risk and really understanding whether this is an improved interaction. Helping them understand how this, helping them getting the right patient in at the right time is that much more valuable than just everybody. And this is where you can see the difference in the outcomes, the cost, and the interactions. It's not an additional load or burden on the providers, but it really helps, and it also could be supplementing their different interactions. So maybe it be office manager, it could be a nurse having that interaction, both pre and post visit, and that really helps the experience overall. And that's what we show, we see, and we see that proof across the board through our different partners, the plans that we work with, the employers we work with, and the providers that we work with.
Specifically for us, how it's very important for us to ensure that we're engaging providers throughout this entire process, right? And so, one of the things that we do is we make sure that all the data that we're collecting is made available to the provider, but we don't make it just available when that member is, let's say, on a path to hospitalization. we make it available at the point of care when that member is ready to have their appointment. And so this is data, for example, that the physician or the health delivery system did not have before. They're usually confined to the four walls of their doctor's office. Now they have an understanding of what the member's state of health is when they're at home. So we push that over to them, and when they're sitting in the exam room, they can use that information to aid in their clinical decision-making process and make recommendations on if they're a diabetes member, for example. Do I need to make adjustments to my medications? Do I need to make adjustments to my patient's insulin?
Yeah, what's important to remember is that the patient's or the consumer's point of decision is different, is not always the same as their point of interaction with the provider. They go interact with the provider, results come back, and then information is shared, and they make a decision around that time. Having the right information that the patient's making a decision with, and then transferring that back to the provider so they can have an ongoing conversation, a shared ongoing conversation, is absolutely imperative. Otherwise, you're always pushing information, and you're going to have a non-compliant patient down the road. Making that, with technology we can do it, with data transfers we can do it, and having that open, transparent information transfer is absolutely critical. And we see that across the board. When you make that happen, you get a much more engaged patient, you get a much more happier doctor.
We have other questions from the audience? Yes, a couple questions in the back.
Are you looking at making that data discrete in terms of importing it into the record, or how is it being delivered to the provider community? Is that a cloud-based additional website that provider has to go to, or do you have, are you able to import that into the EMR in a discrete fashion?
Yeah, absolutely, and I'm sure there are quite a few providers in here. The provider workflow is really critical. Providers have a very defined and set workflow, and there are certain tools and resources that have been thought through and developed for them. What we're able to do is embed into their workflow, pull information out, and push information back into that workflow. So to your point around the EHRs or the medical records, we're able to push that through with protocols that we've developed, and it's a continuous data feed. So we're able to capture not just information, what are the factors that will influence a patient decision, but then their experiences subsequently as well. As they've gone through the different treatments, how is it working? The satisfaction as the treatment usage and outcomes that they're seeing can then be fed back to the consumer, to the provider in the format that they like. It could be back to the provider, it could be it's in the record, but it could also be their nurse practitioner or their care manager who's looking out for them. And that's critical, so that information is delivered in a way that they can actually then act on it, and that's how we enable it.
Yeah, we're doing something similar, and I think it comes down to the patient-generated health data that we're hearing all the buzz about. And to us, it's about collecting patients' data from just their observations of daily living, their activities of daily living, everything from data in their care plans to data produced from questionnaires or surveys, mood monitors, things like that. And we're capturing those discrete data elements and then putting them in a CCD format or a CDA format, so then that patient can download the data that they want to share and send it via direct message through by setting up either with their provider or through things like the Nate Trust bundle and direct that message wherever they want to go to give data where the patient wants. So really looking at consumer mediated data exchange.
We have another question in the back.
Good afternoon. Knowing that the consumer engagement landscape is so dynamic, needs change, resources change, what type of barriers have you faced in that consumer engagement space, and how did you overcome them?
That's a great question. And that nobody wants to answer.
You're absolutely right, and it's a dynamic on a number of fronts. It's not just the channels or the media mode in which they enter the healthcare system. It's who are the trusted sources that they go seek that information out from. So Wiser Together, we focus on conditions where patients actually have a choice. So we call them preference-sensitive health conditions. They're conditions where patients are either living with the chronic condition that's trying to fit the treatments into their lifestyle. There are strong social norms around a treatment, maybe it's a pregnancy or optional treatments such as musculoskeletal or mental health issues where there is a stigma associated with the treatment. All these conditions tend to drive significant cost because there's a lot of more trial error, they're trying to work and fit with the system, and the way folks navigate their healthcare will vary. And this is why it's imperative to really understand who are the trusted sources and how can you position your information and the tools at that entry point. Because not only is the information that the patients seek out is important, but the source that provides that is really relevant. So for example, I'm just giving you another, on certain treatments, side effects is a really important driver, especially drugs. Patients seek that information not from the provider. They trust, obviously, the provider provide information that's with heavy guidance around it, but they seek that information out from peers that have actually gone through that treatment. That's important to them. It's significantly that much more powerful for them in driving a decision. How you're able to provide that in a way that's right, supported, curated, and effective. And that's how you need to think about this dynamically changing world of where patients are going to get this information from and be able to support it. Because if you don't, you're back to Google. They'll go back to Google because they get anything they want, and you lost them for a long, long time.
Did you want to add anything?
I was going to, if you're ready, go ahead.
No, go ahead.
Okay. So I'll make comments from two sides. Let's talk about first from a resourcing perspective. If you take a look at care providers, of course the PCPs is front and center. I mean, their time is extremely limited. And so when you're talking about members that have high-risk chronic conditions, a number of behavioral issues, a 5-minute visit is just not going to do. And so what you need, where we can fit in and where we do fit in, is providing a mid-level provider that provides that attention that these members need. And that attention that we give is not 5 minutes. It's a dedicated 30-minute interaction that they get to have with their health coach, and it's a synchronous conversation, as I mentioned, through the mobile app. So we're able to reduce that or eliminate that access to care barrier. And then from the patient side, one of the big challenges that we've seen is, we'll deliver this care package, and they'll obviously be very excited that they have an iPhone 5C, and they said, you know what, I'm just going to use the phone to talk to my friends, and I'm not going to participate in this intervention to better my chronic condition. Well, one of the things that we're able to do is to lock the phones down remotely from our site. And so we're able to track the compliance and actually measure the engagement rates of our members. And if members start to miss appointments, we will lock their phone down. And we've had experiences where as soon as we lock the phone down, within 30 seconds, our tech support line gets a call. My phone just got shut off. And so what we do is we take them through the explanation that we want you to continue using this phone, but if you want to continue using it, the primary purpose of it is to participate in this intervention and better your chronic condition. And so once we realize it, we've been able to circle them back in, and a number of those members have been extremely successful in getting not only their clinical numbers to very ideal states, but then also seeing a reduction in those hospitalizations and ER visits.
So I was told I have to be really quick, but I will just say one thing. I think for us here in the US, the big elephant in the room right now is meaningful use, and the difficulty it's been for providers is a non-tethered portal trying to get data from those EHRs and working on interoperability and providers across the country to be able to really use these meaningful patient portals because of interoperability. And I will say that I'm really excited with what we're seeing with stage 3 and the open APIs. So I would say don't just give up on these non-tethered portals and really continue to focus on that long-term strategy, because patients are going to demand data. Just out of Washington, a White House movement, we've got getmyhealthdata.org. And there's a petition around. I would encourage everyone to sign up for it. So sorry, this is my little pitch. Encourage everyone to sign up for it. And consumers are going to start demanding data, and they're going to start demanding good applications. And I mean, we have consumers right now that are leaving their providers and saying, that's not a good enough portal for me. My mom went to her provider and they wouldn't give her electronic access, and she said, I'd like all my files, and now I'm going somewhere else. And the more we get educated patients, the more we're going to see that.
That's a great last comment, because it is really important. And one thing that we want to leave you with, we did a video really for Michigan that really talks about why it is so important to have consumers engaged in their own health. So can we roll that video?
Hi, I'm Dr. Matthew Davis. I serve Michigan residents by addressing our public health issues. Michigan Residents Management for Health is changing for the better. Technology is improving our lives in a variety of ways. Michigan is creating an environment for better communication. Having secure access to health information at the right time and the right place can help everyone get the best care.
Having a direct line of communication with my patients helps me to better understand them. Electronic health records, or EHRs, are tools that store health information and allow providers like me to keep track of your health. If I have the information I need when seeing a patient, I'm much more confident and prepared walking in the exam room. It allows me to spend more quality time just having a conversation with my patients and better equipped to answer their questions. After meeting with my patients, I share their health information with them through a web-based patient portal. Patients log in to view their health record, lab results, treatment plan, can even email me with additional questions. Best of all, these tools help them engage in their health.
Using a patient portal is convenient and flexible. I'm constantly online anyway, whether on my phone or the computer, so why not use it for my healthcare? My doctor sends me emails when it's time for a prescription refill or time to come in for a checkup, or even just to ask how I'm doing. My patient portal helps me feel like I'm in control of my health.
With the increasing complexity of health information, we have a need for more communication so we can build supportive relationships and educate each other. The use of technology enhances communication between patients, providers, and the community. There are more options for conversation, leading to a partnership of trust.
It's great that advancing technology connects consumers like me with our healthcare providers. With electronic health records, any provider I see will have my health history. They'll know my illnesses, medications, tests, screenings, and my one drug allergy. It's also reassuring to know that if I'm in an emergency situation, my records will speak for me and prevent complications like an allergic reaction.
My goal is to promote and protect health and wellness, improve health for all Michiganders, and really transform our healthcare system. Meeting all of these goals requires a key factor: communication. Michigan is far ahead of the curve in its creation of a statewide health information network. This network allows health information data from electronic health records to follow a patient wherever they go across our great state. The exchange of health information allows for providers, patients, hospitals, and health departments to share important health data while protecting individual privacy. Michigan is creating an environment for better communication. Having secure access to health information at the right time and the right place can help everyone get the best care. A healthier Michigan is a stronger Michigan.